Good morning, everyone. We are Group 3, and today we'll be diving into the important topic of periodontal diseases. I am Enima Bryan, and joining me are my group members, Crystal Archili and Malik Deeble. Stay tuned for an informative and engaging session.
The following content contains graphic images of periodontal diseases, which may be disturbing to some viewers. These images are intended for educational and informational purposes only. Viewer discretion is advised. If you are sensitive to medical or dental imagery, please proceed with caution.
A silent killer is on the loose. The evidence: bleeding gums, bad breath, and receding smiles. The suspect: periodontal disease. A disease that lurks beneath the surface, destroying its victims from the inside out. Yet, it remains one of the most ignored health crimes of our time. Today our team of investigators Enima Bryan, Malik Deeble and Crystal Archili are on the case, exposing the dangers, the risks, and the urgent fight to stop it. Stay tuned to this documentary as we delve into the facts to help us understand more about periodontal diseases.
Hi, everyone. I am Enima Bryan, and I will be delving into what are periodontal diseases. Now, periodontal disease is a broad term for conditions involving inflammation and infection of the tissues, inclusive of the gum and bone that surrounds and supports the teeth. The pathogenesis of periodontal diseases has been explained through various models over the decades. Basically, each model offers a unique insight into how periodontal diseases develop, but naturally, each model has its own limitations. Now, the pathogenesis of a disease refers to the mechanisms by which it develops, progresses, and either persists or is resolved. And periodontal disease models have changed a lot over the years. At first, scientists thought the disease was just caused by too much plaque. This was in the 1960s to 1980s. Then they realized that specific bacteria in the mouth were harmful, and these were the cause of periodontal diseases. Later in the 1990s to 2000s, they found out that the body's immune system plays a huge role, whereby the body's response to bacteria may have caused more damage to the oral mucosa than the bacteria itself. Now, in the 2010s, researchers saw that it's not just one bad bacteria that causes periodontal diseases to develop, but an imbalance in the whole bacterial community that actually causes the disease, and this is referred to as dysbiosis. Today, in 2025, we know that many factors including bacteria, the immune system, genetics, and the environment work together to cause periodontal diseases. Based on research, there exist two main models that explain the progression of periodontal diseases. One, the continuous progression model, and two, the burst theory. The continuous progression model suggests that periodontal disease follows a steady and constant rate of progression from gingivitis to bone loss and eventual tooth loss. This model also assumes that without treatment, the disease will worsen over time, and these conclusions are made based on early clinical observations where untreated periodontal conditions led to inevitable deterioration and tooth loss. While the burst theory model of progression proposes that a periodontal disease occurs in short, intense episodes of oral tissue destruction, followed by long periods of remission or repair. This model also acknowledges that the disease progression varies within the mouth across different individuals. In today's world, our current understanding of the progression of periodontal diseases combines elements from both models, recognizing that periodontal disease progression can be continuous for some and episodic for others. It also highlights the role of genetics, environmental factors, and systemic health in determining progression patterns in different individuals. Now, we'll take a look at the etiology of periodontal diseases. The primary factor for the cause of periodontal disease is dental plaque. Now, dental plaque is a sticky biofilm of bacteria that constantly forms on our teeth after meals. This biofilm, if it stays on the teeth for a long time and is not removed from the teeth by brushing and flossing regularly, then it will form calculus. Calculus is identified as a secondary factor for the cause of periodontal diseases. Calculus consists of organic and inorganic components. So, the inorganic component of calculus includes the mineralized plaque. And mineralization of plaque occurs when the teeth are continually washed by saliva over an extended period, and as such, the saliva deposits calcium carbonate and calcium phosphates onto the enamel or root surface of the teeth, giving that hard yellow substance we see on the image displayed on the screen. While the organic content comprises of microorganisms and epithelial cells of the mouth. If the mineralized plaque is allowed to stay there for a prolonged period, microorganisms will feed and multiply in the mouth, and there will be a complete dysbiosis of the microorganisms in the oral cavity. And guess what happens when that's the case? Well, it's going to cause irritation to the oral mucosa, and it will trigger a host of inflammatory responses by the immune system, and as such, we may eventually see the signs and symptoms of the development of a periodontal disease. Now, other contributing factors for the cause of periodontal diseases includes indirect causes such as chewing and smoking of tobacco as another factor. Now, tobacco use reduces blood flow to the gums, impairing their ability to help and fight infections. Now, the chemicals in tobacco, they also contribute to plaque buildup and increase the risk of severe periodontal diseases and tooth loss. We also have faulty restorations as another indirect factor. that may lead to the development of periodontal disease. And this is where you have overhanging or ill-fitting restorations, such as dentures, bridges, or crowns that create areas where plaque accumulates, and this would make cleaning difficult. Now, these restorations inevitably will cause irritation to the gums, leading to chronic inflammation and periodontal tissue breakdown. Another interesting factor is a lack of lip seal, which leads to mouth breathing. Now, mouth breathing basically dries out the gums, reducing the protective effect of saliva. And as such, a dry oral environment promotes bacterial growth and makes the gums more prone to inflammation.
Good day, everyone. I am Bryan Deeble, and I will be giving you some facts about periodontal disease. Some of the signs and symptoms are bleeding gums, inflamed gingiva, pain and tenderness, bad breath, loose tooth, pain or pressure when chewing. Some types of periodontal diseases are gingival disease, chronic disease, acute periodontitis, aggressive periodontitis, manifestation of systemic disease, necrotizing periodontal disease, abscesses of periodontium, periodontitis associated with endodontic lesions. I'm just going to give you some information about a few, and at your own time you may pause the video and do your own reading. Gingival disease. The symptoms are red swelling, bleeding gums, tenderness. However, there is no bone loss. The cause for this is plaque buildup, hormonal changes, medication, systemic conditions. Treatment for it is improved oral health, hygiene, professional cleaning with antimicrobial rinse. And not to worry about this is reversible. However, the rest are not reversible. And we have chronic periodontitis, and the symptoms would be gum inflammation, deep pockets, slow bone loss, bad breath. And the cause for this is poor oral hygiene, smoking, and diabetes. Treatment would be scaling and root planning, oral hygiene improvement, and possibly surgery. Another would be the periodontitis as a manifestation of systemic disease. Symptoms would be severe gum inflammation, rapid bone loss linked to systemic condition, and the causes would be diabetes, leukemia, immune disorders. The treatment would be treat underlying disease, scaling and root planning, and antimicrobial therapy. And for necrotizing periodontal disease, symptoms are severe pain, ulceration, grayish gum tissue, bad breath, and the cause for this is malnutrition, HIV or AIDS, stress, smoking, or hygiene. Treatment would be professional cleaning, antibiotics, chlorhexidine rinse, and improved nutrition. Did you know? According to the American Academy of Periodontology, research has indicated that genetics can influence a person's susceptibility to gum disease. That means that even if you have impeccable oral health habits, you can still be at risk. If gum disease seems like it runs in your family, talk to your dentist about your next step. Most people, our parents included, don't say much about gum disease. Gum disease may run in your family and you might not even know about it. Some risk factors of periodontal disease are age, gender, behavior, which would be your oral hygiene habits, non-communicable disease or a systemic disease, psychology, and availability of facilities. So, if you don't have any funds, or if you're in a community that don't have access to public oral health or to any form of oral health, then you're more likely or more susceptible to have periodontal disease. But you have non-surgical treatments, which are professional dental cleaning, removal of plaques and tartar above and below the gum line. You have scaling and root planning, also known as deep cleaning, and this would deep removal of bacteria and tartar from tooth roots and gum pockets. You have antibiotic therapy, which topical or oral antibiotics to reduce bacterial infection. You have laser therapy, which uses the laser to remove infected tissue and bacteria, promoting healing. And we have ozone therapy, which is the application of ozone gas or ozonated water to kill bacteria and promote gum healing. And there are some surgical treatments. I just list the names. You can do your own research about it also, or you can pause the video and do some reading. And that would be flap surgery, bone grafting, guided tissue regeneration, soft tissue grafting, and enamel matrix derivative therapy application. some supportive and adjunctive therapies, chlorhexidine rinse, probiotics, post-modulation therapy, lifestyle modification, regular maintenance. Lifestyle modification would mean smoking cessation, which means you have to stop smoking, improve diet, and better oral hygiene practices. Now we're going to look at the global prevalence of periodontal disease. In the early 20th century, studies suggested that gingivitis was prevalent among children, often viewed as a natural part of childhood due to poor oral hygiene practice. However, severe periodontal disease was less commonly documented. Currently, data indicates that nearly 50% of adolescents exhibit some form of gingivitis, while severe periodontitis is relatively rare in this age group, affecting approximately 0.2 to 0.5%. In adults, in the 20th century, the prevalence of periodontal disease among adults was very high, often attributed to inadequate dental care and poor oral hygiene practices. The disease often went untreated, leading to tooth loss in many individuals by mid-adulthood. Current studies indicate that about 47% of adults aged 30 and over show signs of periodontal disease, with severe forms affected approximately 19% of adults globally. Also, in the early 20th centuries or early 1900s, elderly population experienced high rates of periodontal disease, with many losing teeth by old age. Lack of regular dental care and awareness contribute to the prevalence. Presently, about 70% of adults aged 65 and over have periodontal disease, with severe cases affecting 18.1% of the population. Severe periodontal disease are estimated to affect around 19% of global adult population, representing more than 1 billion cases worldwide.
Did you know that emerging research has shown that periodontitis has been associated both with an increased risk of initial infection with SARS-CoV-2 and with COVID-19 disease severity? The increased risk of infection could be because periodontitis increases the expression of the receptors responsible for entry of SARS-CoV-2 into your host cells.
The Jamaican scenario, current status and challenges. Based on data obtained from the World Health Organization, which was published in 2019, the prevalence of severe periodontal disease in people 15 plus years in Jamaica was 22.7%. Based on the data also obtained from the World Health Organization, which was also published in 2019, the existing risk factors for the oral diseases in Jamaica. Global Prevention and Management Strategies. WHO. World Health Organization, Global Strategy and Action Plan on Oral Health 2023 to 2030. The strategy outlines 6 strategic objectives: oral health governance, oral health promotion and oral disease prevention, health workforce, oral health care, oral health information systems, and oral health research agendas. FDI's World Dental Federation. A Global Periodontal Health Project recently released an online disease profile assessment tool helps assess a patient's risk for periodontal disease and categorize the patient's periodontal disease profile as either low, medium, or high. This is an essential tool to help reduce the periodontal disease burden and raise the priority of periodontal health. Regional Prevention and Management Strategies. UE launches Joint Periodontal Research Program. This program was created in response to the need for research in periodontitis, for which there is a lack of knowledge concerning its epidemiology and pathophysiology in the Caribbean region. National Prevention and Management Strategies. Emphasis on the removal of sugar-sweetened beverages in Jamaican schools, increased taxation on tobacco products, and Second Chance Smile program. In conclusion, periodontal disease is a widespread but preventable condition with significant implications for both oral and systemic health. As we have seen, it progresses from gingivitis to advanced periodontitis, driven by a complex interplay of bacterial infection, immune response, and environmental factors. Early detection, proper oral hygiene, and professional care are keys to preventing and managing this disease. Additionally, emerging research continues to shed light on the links between periodontal health and systemic conditions, such as cardiovascular disease and diabetes. By prioritizing awareness and proactive care, we can reduce its impact and improve oral health well-being.
And this is the end of our presentation. These are our references. Thank you for watching.